Okay, good morning once again. Welcome back. Today we'll be discussing about high blood pressure. We all know about high blood pressure, popularly known as BP. You see an old woman, an old man, or even mostly young people saying I have BP, I have blood pressure. So today, nurse, our director will be talking on this blood pressure, what causes blood pressure, and the preventive measures to this sickness. So our director, over to you.
Thank you. Good morning, good afternoon, good evening. Um, High blood pressure is when the blood running in the vein going to the heart pumps with force because of maybe some blockage on the veins. It forces itself the way it runs and reaching the heart. It has become the work the job is exhausted. I am trying to say it in the simple language where or how some lay people will understand what I'm trying to say. This high blood pressure, it usually occur in lineage. You say this family suffer from high blood pressure. That's what it used to be. But these days, it is seen that majority of illnesses we can rarely call it that it runs in lineage because sometimes the food we eat can cause it now on somebody that is not even in his or her lineage. The drugs we use can bring about certain illnesses even when it does not run in the lineage. However, I want people to understand what can cause high blood pressure so that we can avoid it. First and foremost, salt intake is good because the adage says that food without salt is tasteless. But in taking salt, we need to be very careful. You don't need to put too much salt in the food. And we don't need to eat salt that is uncooked.
More salt.
Any amount of salt you put while cooking the food is what you use. Some people will eat and say, there's no salt in this food, bring me salt. You pour it in the soup and turn and eat. No, it's not advisable. A lot of other things that causes this blood pressure, alcohol, even smoking, all these things contribute in one way or the other to block and reduce the lumen of the vessels that blood run in, therefore bringing about one illness or the other. Because from high blood pressure, you get other illnesses which I cannot mention just now. But when the blood pressure is high, people tend to be tensed up, busy, severe headache. The other day I was talking that headache is not an illness itself, it's a sign of one illness or the other. So, to prevent this high blood pressure, especially in the youth now, some boys and girls, 20 years, 25 years, have developed high blood pressure. It doesn't used to be like that. We know it to be the illness of the older people. Therefore, the activities we carry out these days, it's one of the things that gives people palpitation. It's one of the things that puts people's mind off, and all these things affect the blood vessels that runs to the heart, because anything that weighs down on the heart is bringing one's circulation, affecting one's circulation. Therefore, thereby, with continuous action like that, the person can develop high BP. Thank you.